Hi, I'm Dr. Art Hister, and this is your medical pipeline. And today we're going to talk about the prostate, which is something that most men don't want to talk about. But hey, this is something that you guys really need to focus on. Now, my wife likes to say that the prostate is the real Terminator because it gets all men in the end. It's a little joke she likes to say, but you know what? She's right. It will get all men in the end. If a male lives long enough, he will inevitably end up with some sort of prostate problem. Gram for gram, the urologists like to say, the prostate is the most diseased organ in the body. There are three main ways the prostate can get you. Lots of other diseases, but three main ways. Number one is through infection. That tends to, there are two kinds of infection that we talk about, acute and chronic. Acute prostatitis tends to be a bacterial infection. Happily, it often responds well to antibiotics. You take them for a few weeks and you get rid of it. If it doesn't go away, you enter this stage called chronic prostatitis. That's a real pain in the butt because we just don't have great treatments for chronic prostatitis. You often end up taking antibiotics off and on for many, many months, if not years, and it tends to flare up with certain stresses in one's life. Chronic prostatitis is something you really want to try to avoid if you can. The main way, though, the prostate will get men is as we age, the prostate grows. And the reason that's a problem is that the prostate surrounds the urethra, the tube through which we pee. So as the prostate grows, it squeezes the urethra. So it leads to all those symptoms that all middle-aged and particularly older men know only too well. You can't start peeing as easily. You can't stop peeing as easily. You don't empty your bladder when you go to the bathroom, and you have to go 20 minutes later. One of the most disturbing symptoms of benign prostate growth is the fact that we have to get up at night to empty our bladder so often because we don't empty it fully as well. Dribbling is also a problem with benign prostate growth. You want to try to avoid it. Unfortunately, we don't know a great deal about strategies to avoid it. We do know that men who are obese tend to have much more of a problem with prostate symptoms. We also know that men who develop impaired glucose or diabetes tend to have more of a problem with it. In terms of lifestyle factors, I really can't tell you that there's great evidence that anything makes a difference. The good news about that, though, is men are always interested in this question. Does sex make a difference? If you have frequent sex, does that make your prostate grow? And the answer is we just don't know, so I tend to believe that maybe frequent sex actually helps your prostate.